We talked about the posture. We talked about getting a little bit of an assessment of the hip muscles. Again, when you do the assessment, of course, we want to have a more complete assessment of the muscles of the hip as well. Right now, we want to focus on instructing a pelvic floor contraction relaxation with Leilani. So we use the breath for a few purposes. One is to get a better understanding for her how to work with her breath to really support the healthy function of her core, to be able to relax her abdominal and core muscles. And now the next step will be to teach you how to work with your pelvic floor. So first of all, Leilani is in a lying down position right now. This can be easier or harder for her. The options are in a lying down position, but she can also be in a sitting position, which can sometimes be more beneficial because she actually has a feedback on the pelvic floor. As we talked about before, in a sitting position, the sitting bones should be on the chair. If you're practicing with your patient the pelvic floor contraction in a sitting position, it would be the active sitting that we did before, sitting on the sitting bones with the feet on the ground and the pelvic floor touching the surface of the chair to give her also a tactile feedback. That means a feedback of touch that she can get feedback on if she's doing it correct or not, and even just like getting a sensory feedback on where the pelvic floor is located for her. Beforehand, it's also important to explain where the pelvic floor is. So your pelvic floor is located between your pubic bone and your tailbone, as well as between your both sitting bones. So with a pelvic floor contraction, we're really trying to lift and squeeze those muscles together without using the belly, the bum, or the legs. Okay, so what we're going to do is, as we practiced before the breath, every time you inhaled, your pelvic floor was relaxing, and every time you exhaled, it just recoiled to its natural position. So as we're practicing the pelvic floor contraction now together, I want you to imagine this connection. Every time you will inhale, you will again, as you did very nicely, inhale to your belly and try to feel the relaxation of your pelvic floor. Then when you're exhaling, you will start to contract the muscles of your pelvic floor. That means you will start to imagine you're holding in urine or gas, and you're trying to pull the sitting bones to each other and pull the pubic bone and the tailbone to each other, okay? So basically lifting up and in, holding in feces and gas, stopping the flow of urine. These are the cues that could be helpful for you. Great. So you take your hands on your lower belly just to help you again to reconnect to the breath. So you inhale, a big inhalation into the whole core, but for now we're focusing on the belly. Okay. As you're exhaling, you can focus and imagine that you're lifting and squeezing the pelvic floor up and in, as if you're stopping a urine stream or holding in gas. Okay, we will give you time to tune into that. It can take a moment to actually connect to this area. So if the patient does not understand what I'm saying, if I'm talking about the pubic bone, the tailbone, the sitting bones, pulling them together, if that is too abstract, if the explanation of holding in your urine or gas is too abstract, we need to use different words. It's not always depending on their ability to connect or not to contract the pelvic floor, but also sometimes the way that I'm providing the cue can be not perfect for the person. So there is other cues. For example, imagine that you're drinking a thick smoothie with your vaginal opening, and you're trying to suck the vaginal opening upwards and inwards as you're exhaling. Amazing. At the same time, we want to make sure that when she's exhaling, she's not pushing down her stomach. We want the exhalation to be effortless. Okay, so it's just a recoil of everything and a gentle contraction up and in. Now, for you to make sure and to try to connect to your own pelvic floor, and maybe to check also externally if you contracted the pelvic floor, you can take one hand, and I want you now to take it under your sacrum and look for your tailbone. Okay, if you can find your tailbone. Now, try to place your fingers left and right next to your tailbone, or find the tip of your tailbone. Okay, great. Can you lie back down on the table like this? Okay, great. So this and lying down is one way to check. Now, if you want, you can again continue to relax and contract the pelvic floor as you're breathing. So by placing her hands on the tailbone or around the tailbone, she's now able, with contraction, to feel a certain amount of activation around the tailbone if she's contracting the levator ani muscle strongly. Do you feel any contraction around your fingers? Mm-hmm. Okay, great. So this is one kind of more gentle feedback that we can give. Right now you did it in lying down. We're gonna go over the relaxation also in lying down. In general, the feedback that you can get through external palpation of the pelvic floor, you can place your hands left and right next to your tailbone. You can do this in a sitting position. You can do this in a standing position, and there feel some light movement of either the tailbone or the muscles around the tailbone going upwards and inwards. So that's one way of tactile, like of sensory feedback that we can get through our hands. And another version for Leilani would be to place one hand on her pelvic floor and to see if she can feel the raising of the perineum. So that's basically what we want to also see in the assessment is the perineal area raising up and in. So this area going up and in with your contraction and lowering back down with your relaxation. So Leilani has the options to check this by palpating from the outside, either placing the hand on the pelvic floor from the outside or using the points on the tailbone. Another way, because again, we're not seeing the area, it's difficult for you right now maybe to know if you're contracting the pelvic floor correctly. So you can take a mirror, a small mirror like this, and then just at home, place it between your legs in this position, for example. Place the mirror in front of you and look if you are able to, again here, so looking at the pelvic floor, if you're able to raise this area up and in, if you see that the vaginal opening and the rectal opening are getting smaller when you're pulling them up, and then as you're inhaling into your stomach and releasing, if you can let go and lower the perineum downwards as you go. And one more tip for you also practicing, use the visualization that we also used for the breathing. So you remember with the breathing, we talked about expanding everything into all directions. So if one of the verbal cues worked for you that we talked about, for example, imagining that you're in a situation where you're holding in gas or urine. I usually sometimes say in an elevator, if you're in an elevator and you can't go out, you have to hold in. You can use those imaginations to help yourself. This is the pure basic of how you could instruct your client to, first of all, reconnect, to come to a calm moment, to start and feel the connection of the breath to the pelvic floor. Again, this can be very abstract for some people. Be patient and explain the connection that we see as far as the anatomy goes. Also, the further effect that this relaxation has on the autonomous nervous system, which is directly linked to our bladder, bowel, and sexual health. So lying down on your back is just one position to relax the pelvic floor. We will, again, give this exercise to you to do it daily. You can do the strengthening part first. And then after you did the strengthening, you can take 5 to 10 minutes to really focus on the relaxation. Again, as you did it with the contraction, you can also look in the mirror. If you feel that the relaxation is effective, you would feel and see the lowering of the perineum downwards. You would see that the vaginal and rectal sphincter is becoming more wide and more relaxed. And you can, with every breath, even try to push more air down into your belly, which means basically just relaxing the whole lower abdomen, and actually look at your sphincters of them becoming wider as you're inhaling, and so really to release and lower the pelvic floor as you're breathing. With a mirror, again, inserting a finger to feel if your muscles are becoming more relaxed. So that's something that you could further look at when you have a private moment at home.